Hi everybody, my name is Catherine, and I wanted to share my MAGO therapy experience with other people. When I looked up other videos online on YouTube about MAGO, there really isn't a whole lot at all, and so I wanted to share my experience. And hopefully it'll help somebody out there at some point. My background, about two and a half years ago, I started having some jaw pain on my left side, and wasn't opening my jaw all the way, just different problems and headaches. And about a year ago, I began chiropractic care to see if that would help. And that did help a little bit, and but my chiropractor is not seeing the improvement that he would like to see after being, doing this for a year. And a particular dentist went to their office to talk to the other chiropractors about the relationship between the jaw and the skull and the spine. And so my chiropractor told me about this dentist, and he recommended I go see him, and so I did. And this dentist has had the training to do MAGO. He's had a lot of training on just jaw, facial, all that stuff. And so I saw him beginning of this year, and had several visits, and we talked a lot, tried to figure out what could possibly be the cause of my problems. And I had a CBCT scan done, and that was able to show a lot of just the workings of my jaw, the bones, how everything is. And so at this point, my dentist believes it's probably a genetic thing, the way my jaw is, and it's just not it's not typical, and it's he believes my jaw is probably too far back, top and bottom, and so I've had arthritis in this side of my jaw. The jaw joint, it kind of should be rounded, kind of like a thumb, and my jaw joint is jagged instead of rounded, so it's in pretty bad shape. So he gave me a treatment plan, and that included starting with the MAGO therapy, and after that I'll have to have braces and possibly have to get jaw surgery to bring my jaw forward. But this dentist is really good about trying to figure out the cause, not just treating the symptoms, which is what I really want to do. I don't want to just treat the pain, treat the symptoms. I want to figure out what's causing all this so we can fix it and have it be done and not have to deal with problems for the rest of my life. So that's my problem. So I got my MAGO tray this morning, my very first one, and so I went in this morning. It was about an hour-long appointment, and they ordered it a few weeks ago after taking impressions of the inside of my mouth and doing lots of things. And so today the dentist put the tray in, made sure it fit okay, shaved some parts here and there to make sure it fit the exact way that he needs it to fit. And I was am very surprised at how this feels. I had no idea that it was going to be so big and cumbersome. I had no idea that it was going to affect my speech so much. It's very hard to eat. I tried to eat a piece of cheese, and even that was really hard. So at least for today, I'm just going to eat really soft things, like things I can even drink through a straw. So it's big. It takes up a lot of space in my mouth. There's a little bit of pain. I have had a headache for a lot of the day. Nothing really bad, but enough to kind of keep me down a little bit. There's some tightness, which I mean, doesn't surprise me. I assume that'll get better. You know, I've had a little bit of just soreness around, I guess, as it's kind of, I think I'm probably using different muscles when I have this in my mouth. The dentist did say that when he put the tray in, he could instantly feel my muscles start to get more relaxed. I know that's a big part of the problem for me, is that with my jaw not working the way it should, I have all these really tense muscles that are being overworked. And so I guess that's probably why I'm feeling just a lot of some discomfort around here. So from here on out, I'll have to go in every week to get the tray looked at, altered a little bit, and then that's going to just be the slow process that I have to go through. My case is a little more severe, and so I have to wear this for about 9 to 12 months. Which is a little depressing. I know it'll get better. I know as time goes on, it'll get a little smaller, and I've been told I will be able to learn better to eat and talk. For now, it's just really, really in the way. It's really, I gotta be honest, I've been kind of sad today because of how it feels and the way, how much it's affecting my daily activities. I was very surprised about that. I was not told that it would be like this. When I first came back from the dentist with the tray, my kids looked at me like I was a freak because of how I was talking, and honestly, everyone I've talked to today is kind of looking at me that way because so it hasn't been too fun of a day. I'm trying to be positive. I know it'll get better. Yeah, that's my experience so far. I'll take it out so you can see what it looks like. Sorry if it's kind of gross, but it's in there really well. It doesn't move at all. It's suctioned in pretty tight. But it's a little hard to get off, but okay, sorry if that's gross. But I just wanted to show you what it looked like. So my mouth is, now you can understand me a little better. My mouth has kind of a funny shape to it, as you can see. That one side is longer than the other side because I didn't get that wisdom tooth taken out, but I did on the other side. So that's why it's a little bit uneven shaped. But this is what it looks like. And you can see this area right here is what's just kind of sticking out in my mouth. Like this, if you saw when I was wearing it, this doesn't, sorry, my 1-year-old. This doesn't cover my front teeth. So this is kind of goes below my teeth right here. And it may not look very big, but it's very big in my mouth. It feels very big. You know, it's clear, and I'm not even really concerned about how it looks. For me, it's more the talking, the eating, and just the feel of it in my mouth, and how uncomfortable. I'm not used to that at all, and just feels really big. And I mean, I can't even close my mouth really well around it. Anyway, so I'm going to put this back in. So it's not too hard to put in or out, or take in or out. And I have to wear this 24/7 when I'm eating, when I'm sleeping. The only time I can take it out is to... Sorry, I'm trying to keep her a little quiet. There you go. Only time I can take it out is to brush my teeth. And that's it. Today is May 23rd of 2019. And I'm hoping to update you guys in the future. I'm not sure how often I'll do this, but hopefully I have some good news and can tell you that it gets easier and gets better. And yeah, so if you have any questions, feel free to comment and I'll answer what I can. I'm still pretty new to this myself, but as time goes on, hopefully I'll be able to answer more questions and give more advice. But thanks for watching.